when we talk about these different trials, we mean phase 1 is something that's very early. Sometimes it's even done in people with normal types of normal types of problems and not necessarily illness. Phase 2 means it's done in people who are sick with different doses and trying to, in a shorter term, to see if it works. Phase 3 means it's meant to get the answers on how well this works and how it compares to other treatment. And phase 4 is just some more information adding on. All right, so let me talk about a trial that we're very interested in trying to get people about. In fact, this is one of the easiest research trials that's ever come along for people with MS. It's designed to look at walking impairment treatment in people with MS. It's a medicine that goes by this name, but it's basically a high-dose sustained release amantadine made by Adamas Pharmaceuticals. It's already had positive trials in Parkinson's disease. And this is about a 6-week research trial, and it is a blinded trial against an inactive medicine. It's a very low-risk medication, and it is something that we can even try in MS patients who aren't in the trial, but we recommend everybody who wants to do this try it in the trial, because it's actually, you may find out that the medicine is a superior form. It's not going to be immediately available. This is a phase 2 trial, and phase 2 trials mean the medicine has a ways to go before it gets approved for the particular purpose, but this medicine is actually close to approval in the next year or so with Parkinson's disease. And if you want to go to this location here, clinicaltrials.gov, with this additional designation, you can read more about this. But I'm going to summarize this for you right now. So the whole purpose of this trial is to look at an investigational formulation of amantadine, which is dosed once daily. It's a larger dose, and it's a very slow release, and it's given once daily at bedtime. It actually achieves a high level of amantadine during the early morning and through the afternoon, and it's lower in the evening when people are sleeping. And it's meant to try to reduce any adverse effects of this medicine on sleep, because it has stimulant effects. Many people with MS have taken it as a stimulant. All right, so what is the research about? There's tests of walking, a 25-foot time walk, a 2-minute distance walk, what we call timed up and go walk, which people get out of a chair, they walk a short distance, and they go and sit down. There's some tests of thinking, what we call McFIMS battery, that's a verbal and visual memory decoding task, and some questionnaires. And there's just a few visits: a screening visit to check some labs and make sure people qualify, a baseline visit where people start on the medicine and do the testing, 1 at 2 weeks, 4 weeks, and a follow-up visit. Now, the amazing thing is this is open to one of the largest groups of people that's ever been seen for MS, and 18 to 70 years old, anybody who's not in a relapse. They have to be able to walk at least 25 feet with any aids in at least 8 seconds and less than 45 seconds, and able to walk 20 yards with a walker is also a requirement. You know, of course, if people can walk without it, it's just fine. There's a lot of requirements in terms of health. Somebody can't have had seizures. They can't have had steroids or physical therapy in the last 30 days. They can't be on Ampyra, stimulants, or amantadine for 30 days. Can't have had cancer in the last 5 years, no severe blood or liver abnormalities. They can't have bipolar disorder or hallucinations in the recent history. They can't have had a stroke or TIA or heart attack recently. They can't have had Botox for spasticity, not for other reasons like bladder and migraine. And they had to be willing to use contraception if they can still conceive. There are some medicines that are forbidden. It's a long list. We'd go over it with you. These are all things that can be stopped at least 30 days in advance. And but some people who think that they can't live without Ampyra, this is a trial that's not for them. This is for people who can stop it and want to try something different. And this includes some stimulants that can't be used. And why is this? Well, because we're testing thinking, and they also want to be sure that there's not a drug interaction. So at this stage, the goal is to avoid problems and just get an answer whether it helps people. So if somebody is interested, they can email us at frontdesk@neurosci.us. We'll set up a free screening visit. We may need your medical records to see if you qualify. This is an opportunity for people with walking impairments both to learn something and to be able to find out if they can help everybody else learn something. And if this medicine is effective in this trial, it will go on to further testing. And what I can offer people who are going to see us afterwards is if they want to try amantadine again for some of these indications, we'll have done a lot of cognitive testing and walking testing. We'll be able to see if it works for you with very precise measurements. So let me ask you to hold questions for a little bit, and we're going to come back here to the other studies. Give me just one moment. All right, so let's go on to the next trial. If I can get this to. Boy, when you turn on this pointer, it's really annoying. There we are. It doesn't work right. All right, there we are. All right, so the next trial is a really exciting one. It's called Optimum. And the Optimum trial is a landmark study. It's an opportunity to participate in a piece of history. It's the first trial of one oral medicine against another head-to-head. And there is no inactive medicine or placebo. It's being operated by a Swiss pharmaceutical company called Actelion, which is a small company you probably haven't heard of. But they are going to be testing their medicine, which is like Gilenya. It's a new S1P modulator, and comparing it to a medicine called teriflunomide, which is on the market in the U.S. as Aubagio. It's 108 weeks, which is about 2 years, and there will probably be an extension study afterwards where people can be followed on the ponesimod for a longer period of time. And MRIs are done, but they're not seen by the doctors, and they're not used for MS management. They're used just to measure the treatment. People can still have MRIs done outside of the trial. Just a moment, trying to get the tools up here. All right. All right, so you can have relapsing or progressive MS. That's the interesting thing about this, is you don't have to have just relapsing MS. As long as you have relapses, you can have very significant gait problems as long as you can walk at least slowly 300 feet without a cane or holding onto the wall and resting only briefly. You have to be between 18 and 55 years, so people over 55 are usually discriminated against in these kind of trials. We're sorry, but it's mainly to prevent any unexpected problems. Someone has to have had one or more MS attacks in the prior 12 months, or 2 or more MS attacks in the last 2 years, or a abnormality with a new active gadolinium enhancing lesion on a brain scan in the last 6 months. We talked about the walking. Women who can get pregnant have to use contraception during the trial. Someone who can't do MRI or has had a really strong medicine like Gilenya, like Lemtrada, Campath, Novantrone can't be in there. People who've been on Aubagio, Areva, or Gilenya also can't be in the trial. There are some forbidden medicines that people can't be on during the trial, which includes some blood pressure medicines, particular blood pressure medicines, or regular steroids. You can read about this trial online here, and it is a very very important trial because it's going to tell us some things about the differences between these two types of medicines. All right, so basically, because this trial is a no placebo progressive, includes people with progressive MS, is a well-tolerated medicine with pills, and you and your doctor are not sure which medicine is. It's kind of a dream trial because the medicines have so few side effects people can't really tell, and they're both effective, good medicines. This medicine's already been proven in a phase 2 trial. The study's being done because Actelion believes it's going to be better than Aubagio, and that the medicine will have less heart issues than Gilenya and better than Gilenya to make it marketable afterwards. The trial is about 2 years. There are regular visits that are in the beginning monthly, and then they go out to every 3 months once people are on medicine for a while. There is a first dose observation involved, just like with Gilenya, regardless of which medicine people end up taking, because they won't be able to tell. And it's usually about 4 hours. It's shorter with this medicine because there are less changes in heart rate. And people often ask me whether they can get medicine after a trial. The companies create a trial after the main study if it looks like the medicine's going to be successful. That's to get longer term experience. They've invested a lot of time and effort to understand people's MS, and they usually try to keep them on medicine as long as possible. There is some payment for participating in the trial. There's some reimbursement that's dependent on how far people drive, but there's also payments for visits. It's not like a job. All right. So if people think they might be interested, we may need to see their medical records to even talk to them in detail about it, but generally what we do is offer a free screening visit with us, and we allow people to ask whatever they want about the study. You can email us for more information. What we generally do is we're going to send you back, once you give us some information about you to see if you qualify, we're going to send you back what's called an informed consent. It looks kind of like a contract. It's not a contract. You can write all over it and ask us questions, because if you're going to be in the trial, we'll have you sign a clean one. It just explains in very marked detail what's involved in the trial and what the risks or the benefits are. And generally with these medicines, the risks are very well understood already when they get to this point. And if you're familiar at all with Aubagio or Gilenya, the risks are the same as those medicines that are available. And so this is an excellent opportunity to help everybody learn something, to get an effective oral medicine. The only restrictions are you have to fall within the group of people and the amount of disease activity that are indicated, and you can't have taken these medicines before, or really strong medicines. If you've been on Tysabri, you have to have been off it for 6 months in order to participate in this trial. And there's a few other medicines that you can have been on permanently, but most people aren't on those medicines. All right. So I want to talk about in this final slide here, just say good trials fill up fast. And it's a real opportunity to learn about your MS, to be a part of history, to learn especially about, there's a lot of cognitive testing and gait testing are done. You can actually measure your performance during the trial. I call being in research donating your body to science while you're still alive. It's actually a much more good use for you than donating yourself to a medical school should you happen to die someday, and we always hope that doesn't happen. There is one other trial that's available that offers, it's very simple, it's called Research Only because we're collecting data, and we're looking for people who have started an MS treatment recently, who want to be in a comparison trial for Gilenya. They're looking for people that have started any other medicine besides Tysabri and Gilenya recently in the recent 6 months. If you come in, you get an exam and a going over, and you answer some questions, and you get a free dermatologic exam as part of the study. They just want to be able to see you periodically and make sure you're doing okay in order to use you as a comparison group for health problems with people who are starting Gilenya. If you are going to start Gilenya and you want to be in this trial, you can also do it, but we have to see you from the very beginning before you start the Gilenya, and you have to start it with us at our program. But this offers a couple visits for free in the course of doing this, and you help everybody learn something important about the risks and the benefits of medications. Well, I'm going to stop there, let people open up for questions. You should be able to see the questions. I notice there's already one up here, and I'm going to answer that. And there's a question about whether somebody with both ML, MS, and ALS is a likely candidate. The problem with when people have more than one disease, they're usually not a candidate for research trials, because the research trials are trying to ask a very specific question, and when there's other illnesses that are involved, it makes it very hard because they're looking for a group of people that's as much alike as possible. However, there are a lot of other things that can be tried to help people who have various combinations of diseases. Probably the most common things I see is people with MS and back pain, or MS and as they get older they have a stroke. But MS and a lot of other immune diseases occur together. ALS has enough effect on people's course that it's usually not able to be in a trial for any other illness. But there are research trials out there for MS. And there are research trials out there for ALS, and you may meet a criteria for one or the other. Now, this website, clinicaltrials.gov, that you see me referencing for these other studies, it's a very important it's a very important website to be aware of. And this website is quite a excellent website in the sense that you can find information quickly, and the good thing is a lot of it is reliable. It may not be as much information as you want to see. I am trying here to find this presentation, and I couldn't find it here. Just a moment while I flip back out of the screen so I can get this presentation up. All right, I'm going to turn off the all right, you can still see me, I hope, but I am just trying to get this get the file uploaded for you that is got that research information here in case you want to share it with a friend. And okay, I'll save that out there, and there we are. Okay, so I am gonna upload this real quick to where you can find this presentation if you want to share it with a friend, or you want those references to the website are in that PowerPoint. You will need a PowerPoint viewer. I want to open it up to any questions about the research, and then after we've got all those questions answered, I'm happy to answer any other questions about the MS. Tonight it's going to be a fairly short presentation, and we'll let you get back to enjoying your evening. Any other questions? All right, any other questions about MS from anyone? All right. I want to tell everybody also that Dr. Joy Derwinskis has joined Advanced Neurosciences. She's going to be giving a presentation in the next week, and a week from today at 6:30 rather than 6 o'clock on women's issues in MS, right? Symptomatic management of MS. All right. So there's a question about MS and Ehlers-Danlos. Ehlers-Danlos is a genetic problem that is, it's not very rare. Severe versions of it are very less common. But there's been no established association between MS and Ehlers-Danlos, and MS is a fairly common illness. We think around 1 to 2% of white women get MS. So it's not that rare to see these associations. There are a few diseases that are unquestionably associated with MS. These include thyroid disease, inflammatory bowel disease like Crohn's or ulcerative colitis, psoriasis, B12 deficiency, and there's family relationships between a lot of immune diseases and MS that we'll see them. And Ehlers-Danlos is not, unlike these other diseases, the Ehlers-Danlos is a very well understood disorder of the formation of collagen, of which there's a number of proteins that form our tissues, and people with Ehlers-Danlos have some collagens that are the sturdier ones that don't work right. They have a propensity to get aneurysms. They have a hyperextensible joints. So they tend to get a lot of arthritis. They occasionally will have a blood vessel rupture. They have tissues which are more delicate. And this is, as far as we can tell, is unrelated to the MS. Now, it just so happens that when people are sick, people get a good going over by a lot of doctors, and it's not unusual to find another problem. All right, great question. All right, well, if there aren't any other questions, I'm going to wind it up here, and you should be able to download that handout if you want it with the information, and you can certainly give us drop us a line at frontdesk@neurosci.us or call us. You can find us online at neurosci.us as well to get our phone number. And if you're interested in these research, that's great. We'll do our best to help you participate. But it is we usually screen through 5 or 10 people before we find somebody who fits all the criteria. But that's part of learning how to find people and getting this done. That's everybody who wants to help is great, and if you're not sure you can participate, passing the information on to someone else would be great. And just a reminder, I don't have the information in here on this other trial for people who've recently started. It's called the Passage trial, or Passage, and it's for people who have started anything other than Gilenya or Tysabri recently. Get a free skin exam as part of it, and a couple free visits for filling out some questionnaires and coming in for a couple of visits periodically, and to be followed. So thank you very much, and we're going to say good evening, and I appreciate everybody tuning in.